Good morning, everyone. I'll be speaking on the study of clinical profile and surgical intervention, a case series of advanced retraction syndrome, no financial disclosure. Advanced retraction syndrome can be classified on the basis of the ocular deviation in the primary position into type 1, type 2, and type 3 DRS. And the classical clinical features include limitation in abduction, variable limitation in adduction, globe retraction, and upshoots and downshoots on adduction. The indications of surgery remain significant ocular deviation in the primary position, marked anomalous head posture, severe globe retraction, and disfiguring upshoots and downshoots. So we studied the clinical theological profile and surgical intervention in a case series of DRS. It was a descriptive pilot study and included all the patients who were diagnosed as DRS from January 2017 to April 2019 with minimum follow-up of 6 months. The methodology included written informed consent, comprehensive ocular examination, and the orthoptic evaluation was done, which was followed by MRI only in indicated cases, and surgical intervention, which was case-based. Coming to the results, the total number of cases with a follow-up of 6 months were 15, out of which 11 were female, and 40% had bilateral DRS. We found that the frequency of abnormal head posture was seen in majority of the cases, and patients with face turn were around 56%. 56% of the patients had strabismic amblyopia, which was followed by patients with visual deprivation amblyopia, and the anisometric amblyopia was seen in the minimum number of cases. The esotropia and exotropia was seen in equal frequency in all the cases. We also had severe globe retraction with upshoots and downshoots in around 10 cases. The pattern of ocular motility was only abduction limitation was seen in 46% of the cases. Combination of abduction and adduction limitation was seen in 46% of the cases, and only adduction limitation was seen in 8% of the cases. According to the primary angle of deviation, which was around less than 20 prism diopters, we defined it as small angle, and that was seen in around 50% of the cases. The treatment was surgical intervention, and it was case-based, and it was tailored according to the clinical findings and the intraoperative findings. The different procedures which were done, Y-split with LR recession, whether unilateral or bilateral, was done in majority of the cases, followed by Y-split LR recession with MR recession, and bilateral MR recession or SRT with MR recession was done in minority cases. Coming to the follow-up of 6 months, Y-split surgery was done in 53% of the cases, and unilateral Y-split was done in 41% of the cases. If we talk about the success of our results, we were able to achieve significant improvement in the cosmetic appearance and also significant resolution of the face turn with successful ocular alignment around 70% of the cases. There were only a few cases, less than 10%, in which we had residual globe retraction with residual upshoot, and that was only in severe globe retraction patients. So we compared our study to the findings of various studies which were published in literature, and we found that the similar findings were there was a female preponderance, higher incidence of unilateral cases with left eye which was dominantly affected. Type 1 was the most common. 50% of the cases had abnormal head posture on presentation. Small angle of deviation was seen in the primary position, and surgery was the mainstay of treatment, with Y-split lateral recession proved to be very effective in treating the upshoots and globe retraction. The findings which were unique to our study were variable incidence of adduction limitation, equal frequency of ESO and exotropia and DRS, severe globe retraction, which was more commonly seen, and both horizontal recti recession was able to treat 50% of the globe retraction. 70% success and 71% success was achieved in correcting the face turn with optimal ocular alignment. And not much significant improvement was seen in the ocular movements. Thank you.
Okay, nice presentation. So I wanted to ask you, did you operate in all the cases, and what was your indication of surgery in all these cases?
Yes, sir. So, advanced retraction syndrome, I have included the cases, all cases were diagnosed as DRS, and all these were the cases in which a surgical intervention was done. The indication of surgery in most of these cases were ocular deviation if it was more than 20 prism diopters in the primary position, or there was an associated abnormal face turn, or there was a significant globe retraction with upshoot. So all these cases, most of them had a significant ocular deviation in the primary position, and around most of them had abnormal face turn also. And around 60% of the patients had globe retraction with upshoots.